Figured out early on what nurses did. I actually thought I wanted to be a physician. I had a pediatrician that I loved, and I was mesmerized by what he did. As soon as I got old enough to be a candy striper in the hospital, I went and signed up. I could not wait because I wanted to learn more about that. I very quickly learned that physicians didn't spend a whole lot of time with patients. It was the nurses, and I didn't know any nurses. I didn't have, any preconceived notions, but watching those nurses, I changed my mind right then that that's what I wanted to do. And when I got out of school, I started in the surgical intensive care unit at Atlanta Medical Center, and I had a wonderful preceptor, and she actually taught me to love trauma patients. She had a love for them and how they're kind of different.
We plan to have elective surgery, we plan to have babies, we plan to do those things, but we don't plan to be in a trauma. And they can happen anytime, day or night. And what I find with Gina is she's always there for those patients, whatever their needs are. Because a lot of times it's emotional needs. It's not the physical needs, because they're being cared for. She helps them to learn how to cope with that.
You don't always win, because sometimes it's how can you positively impact a horrible situation.